Good morning, dear student. Today we are going to start our last topic of fifth unit, clinical laboratory test interpretation. Uh, in previous class, I discussed about the test of urine analysis, blood analysis, and other common tests. Now we will cover entire pathological tests which are going to held in the laboratory for the diagnosis of disease. So you can see clinical laboratory tests results are a very important parameter in diagnosis, monitoring, screening. 70 to 80% of the decisions in the diagnosis are based on laboratory results and more laboratory analysis as requested. The lot of uh, data are provided and therefore imperative of the patient care and safety. That is, a clinician are familiar with the taste and interpretation of the result. The laboratory result must be interpreted on the background of the reference intervals and used in the distinguish between the health and disease condition. The clinicians must also evaluate the result from the knowledge of biological variation and be aware of the potential risk of false interpretation. Likewise, inference of random error and the systematic error on the result is important. As well as diagnostic sensitivity and specificity of the test. The laboratory has certainly also a role and the responsibility in the providing clinician with adequate information that can be assist them in the correct interpretation of the data. So laboratory tests are very important to find out the disease condition of the patient as well as to find out the symptoms of the patient or the accurate accuracy to cause of the disease by the interpretation of result pathological result of the patient report. The lab test result may be positive, negative, inconclusive. Your doctor will be discuss what your test is result means for you and your health. In previous class, I discussed what is positive, negative, and inconclusive test. Now, a positive test result means that the substance or condition being tested or was found. Positive test result also can mean that the amount of a substance being tested for is higher and lower than the normal. This positive test. Now negative test result means the substance and condition being tested for was not found. Negative result can be mean that the substance being tested for the present in a normal amount. Means if test is negative, there is a no matter of seriousness. But if test is positive or it vary from the normal value, then that is a serious matter to be considered. Now, in conclusive test, result are those that are not clearly positive. For example, some test measures the level of antibodies to some bacteria or viruses in the blood or the other fluid to look for an infection. It is not always clear if the level of antibodies is high enough to indicate an infection. What are the false positive, false negative tests? I discussed in my previous class this thing also. A false positive test result is one shown in a disease condition is present when it is not present. A false positive test result maybe suggest that a person has disease condition when he or she does not have it, just like a false positive pregnancy test. Similarly, false negative test is the result one that does not detect what is being tested even though it is present. Just I told you in my previous class, if you are uh, going for the test of malaria parasite MP, and at that time you are not having any fever, any shivering, uh, then it taste may be negative, but actually you are suffering from the malaria. That is, doctor or pharmacist or pathologist suggest that if you are having high fever, at that time you have to take the blood sample for the test of malaria. Then only its result will be become a positive. Now, next is what if your results are different than the reference range. Uh, it is possible that is different than the reference range even though the nothing is wrong with you. Sometimes certain factors can affect your test results such as pregnancy, medicine you are taking, eating right or before a test, smoking, or under stress condition, your reading may vary from the normal ranges. So, if your symptoms, you are not having any symptoms and you are having some difference in a result, then you must take another, go for the another test because uh, there is a this factor maybe affect your result. May, it is a chances of that. Now, why do value or reference ranges vary from the lab or laboratory test? Labs may be used lab to lab. Labs may be used different type of equipment test, and sometimes they set their own reference ranges. If equipment is you are nowadays no blood test is going to held in a laboratory. They are having a automatic machine made up in a South Korea or made up in a Japan, and they put the sample, blood sample, and all CBC, complete blood count report will come. There is a no manual method to take TLC or this DLC, differentiate leukocyte count, total leukocyte count. That is a method earlier before the 2000. It is counted by manually in a microscope by the pathologist, but now it is doing by automatic machine. And if you are taking the machine made up from China, South Korea, or Japan, that the result may be vary from lab to lab or machine to machine. Equipment also or chemical also you are taking in a laboratory, they also affect the result of or value of your result. Now we are going for first test, that is CBC, complete blood count. It means uh, all tested in the blood or blood related test is come in this value. Or here all counts, blood counts will come under this test. The CBC is one of the most common blood tests. The CBC can help detect the blood disease disorder such as anemia, infection, clotting problem, blood cancer, immune disorder, etc. Peripheral venous blood is collected in a lavender tube contained with Anticoagulant, uh, here we are using as a EDTA as anticoagulant and should be thoroughly mixed. Unacceptable specimen clotted or greater than 48 hours old, that is not used. Methodology is using for the CBC is whole blood analyzer that I told you, that is automatic machine. Now, normal value of uh, a red blood cell in a male is 4.3 to 5.9 lakh per ml per square ml. That is a area uh, per ml, or it is counted in a under the slide in a manual method earlier, but now it is uh, calculated automatically by the machine. Now, deficiency of RBC give the or reason due to the hemolytic anemia, decreased number of RBC, excessive bleeding, hereditary spherocytosis, that is a disorder, rare blood disorder in a defect in which the RBC causes them BS like a sphere and break down easily. uh, Elevation of RBC means if RBC count is increases in a patient, that is called polycythemia, over the production of RBC. The primary polycythemia caused by the overproduction of RBC by the bone marrow due to the mutation of biological factor in the body. Secondary polycythemia, it also in which also RBC increase, which is caused by the factor that reduce the amount of oxygen reaching the body tissue, such as smoking. In my earlier class, previous class, I told you smoking is a uh, main cause to increase the hemoglobin level in a body or RBC count in a body. So smoking is a important, um, not important, that is a bad habit which affect the um, patient, patient values, or uh, it increase the RBC count as well as hemoglobin count. If you are living in a high altitude or any heart disease, then also chances of RBC count may increase. Now, the red blood cells is in some patients with the secondary polycythemia may carry an abnormal form of hemoglobin that does not release oxygen readily. That is called high affinity hemoglobin. In that condition also there is a chances of increase the count of RBC. Now, red blood cells enzyme disorder. Now, red blood cells enzyme disorder are the important to recognize and diagnose for the proper supportive care, monitoring, and treatment. That is number one. Glucose 6 phosphate dehydrogenase enzyme. Deficiency of X-linked disorder, most commonly characterized by the episodic hemolysis in the setting of oxidative triggers such as uh, Pava beans, that is a type of infection, and certain medication also affect the level of dehydrogenase, glucose 6 phosphate dehydrogenase concentration decreases. And now, enzymopathic such as pyruvate kinase deficiency should be suspect in a patient of all ages with the chronic hemolytic anemia in the absence of immune-mediated hemolysis. The hemoglobinopathy or the evidence of red membrane cell disorder. In this condition also, it affect your RBC count. Splenectomy, when a spleen is removed from the body, the partially ameliorates the anemia in the most of the patient with pyruvate kinase deficiency or the other red blood cells enzyme disorder in the case of when spleen removed from the body in some patient. Glycolytic red cells disorder, it causes the congestional hemolytic anemia with wide the clinical heterogeneity, and the frequent complication includes neonatal jaundice, gallbladder stones, both transfusion related and transfusion independent iron loading. So these are the factors which cause the glycolytic red disorder. Now, mean corpuscular volume, that is MCV. MCV is measured in the average size of your RBC. Abnormal MCV levels may be a sign of anemia or thalassemia. The normal value of MCV, that is measured in volume of RBC in 76 to 100 mm cube, and macrocytic, in the case of macrocytic, increase the RBC size, microcytic, that decrease the RBC size. Now next is disorder related with white blood cells. The concentration of normal value ranges from 4,000 to 11,000 WBC in per microliter volume. Neutrophils, it become a 2,500 to 7,500 micro per liter. Eosinophils, that is 500 micro per liter. Or basophils, it is ranges between 0 to 300, and lymphocyte is 3,000, approx 3,000. That is the range, 3,000 to 3,500. In between monocytes, it becomes 200 to 600. When if you are having or suffering from the dengue fever, then your platelets count or that um, lymphocytes counts, that also decrease. Platelet counts also decrease, that we will see in later. But if you are feeling you are suffering from the common cold or uh, disease which is related with the allergy, then your eosinophils count will be increased. If you are having the uh, long back constipation problem or digestion problem, then your monocytes will be increased in your blood. So by this changes in a range of different WBC, these are the type of WBC that I told you. Is neutrophils, eosinophils, basophils, lymphocyte, monocyte. These are the, if the these these differentiate leukocytes ranges or changes or vary from the normal value at that time, then we can predict the decision of or disease condition of the particular patient. Please mute your mic. संजना, बेटा म्यूट करो माइक को. Okay. Now deficiency of WBC. Leukopenia, decreased number of WBC. Neutropenia, decreased number of neutrophils. Basophenia decrease the number of basophils it, because of thyrotoxicity or hypersensitivity reactions. The lymphocytopenia decrease the number of lymphocytes in the case of viral infection, systemic lupus erythematosus, SLS, and rheumatoid arthritis, myasthenia gravis. It causes the decrease your lymphocytes in a body. It also affect the or cause the bleeding problem. The monocytopenia decrease the monocytes, that is called monomic syndrome, the risk of infection with certain organisms, including the group of bacteria known as Mycobacterium avium complex (MAV), MAC, that related with a tuberculosis and human papillomavirus, that is called HPV, and also certain fungi also responsible for the monocytopenia. Now, if elevation of WBC, when leukocyte increase more than 11,000 microliter, in the case of a certain infection, body infection, it chances of increase the elevation of WBC. The neutrophils, it is called leukocytosis, increase the number of neutrophils, basophils, which increase the uh, number of basophils in the case of hypothyroidism. That is a main factor. Eosinophils increase the number of eosinophils. I told you it is because of allergic reaction or common cold. This number is increased. The fungal disease, allergy condition, skin disorder are responsible for the number of eosinophils increase in your body. Lymphocytic leukocytosis, it increase the concentration of lymphocyte in the blood. Uh, Monocytic cytosis, that increase the number of monocytes, that is a sarcoidosis, and Langerhans cells, uh, it is related with the pancreas, isolate of Langerhans cells, uh, dysfunctioning, uh, or autoimmune disorder due to this monocyte concentration will increase. Now, platelet, I told you this platelet count is suddenly decreased in the case of, or in the, if patient is suffering from the dengue. Uh, the deficiency of platelets is cause the bleeding, and low number of platelets occur in the blood. The elevation of platelets is called thrombocytosis, increase the number of platelets. Now, other test is blood clotting test or bleeding test and blood clotting test. That test is we are conducting before the operation. If patient is going for any kind of surgery, then uh, before that this test is compulsory to conduct with the patient, because in some incision and cuts uh, we are making for the surgery. Now, factor VSA, this test is measure factor V as a substance involved in a clotting. An abnormally low level may be indicative of the liver disease, primary fibrinolysis, the breakdown of clots, and disseminated intravascular coagulation, that is called TIC. The fibrinogen level is is a protein made up by the liver. This test measure how much fibrinogen is in your blood. The abnormal result may be a sign of excessive bleeding or hemorrhage. The fibrinolysis or placental abrasion, which is the separation of the placenta from the uterine wall. This fibrinogen level is play important role in a blood clotting. The prothrombin time, that is PT or PTINR. Prothrombin is another protein produced in a liver. The prothrombin time test is measure how well and how long it takes your blood to clot. It normally takes 25 to 30 seconds. It may take longer if you take blood thinner. Other reason of the abnormal result, when patient is suffering from hemophilia, some liver disease, or malabsorption of nutrition or proteins. It's also useful in a monitoring of those who take medication that after clotting, such as warfarin. Warfarin is a good anticoagulant. Now, blood clotting test is PT prothrombin time test, and other test, that is time, uh, clotting time. Prothrombin timing is 9.0 to 11.7 second. Another test, its timing is 0.9 to 1.2 second. Another test, heparin monitoring test, that is PTT, and it is here the clotting time or ranges between 55 to 75, and the fibrinogen and APTT test also given the time in a second, and fibrinogen, that is the concentration of fibrinogen protein. This test is usually conducted for the to detect the clotting time or for the clotting of blood in a, of the patient before the any surgery. Now, student, we have only 10 minutes to and slides are more. We will continue tomorrow also. Now I am continuing this. Hemoglobin, it ranges from 14 to 18 mg gram per deciliter. That is in male, and in female 12 to 16 gram per deciliter. Now, normocytic, when hemoglobin levels are decreased but the RBC size is normal, uh, that is called that is due to the acute blood loss, anemia, or chronic disease. Hemoglobin level is decreased in the patient, but RBC size is normal. Secondly is microcytic, that is insufficiency of hemoglobin synthesis, iron, because of iron deficiency, anemia occur, or in the case of thalassemia. Macrocytic deficiency of vitamin B1 or folic acid, it causes macrocytic anemia, or hemoglobin concentration will decrease. Similarly, the sickle cell anemia, the alteration of hemoglobin structure, that is your RBC become a sickle type. Now, hematocrit is a measure how much space red blood cells take up in your blood. A high hematocrit level might means dehydrated. A low hematocrit level might mean have the anemia. Normal hemocritic level also may be a sign of blood or bone marrow disorder. So hematocrit level is an important factor which must know regarding the patient condition. Laboratory test for cardiovascular system. First is troponin. When the muscles or the heart cells are injured, there are troponin leak out and its level in the blood is rise. The blood level of troponin rise when uh, you are suffering from the heart attack. Now, second is ischemia modified albumin, that is IMA. High level of IMA indicate the ischemia. Ischemia is a condition in which your heart muscles getting a less oxygen and the oxygen reaching to the heart muscles is very low. That is in this condition is called ischemia. Now P-type natriuretic peptide test. That natriuretic peptide test (N.P) test is the blood test that measure the level of protein, that is called PPN. B-type natriuretic uh, protein that is made up by your heart and the blood vessels. The NP level is higher than the normal level, then it is a condition of heart failure or maybe chances of heart failure. Normal value is 100 picogram per milliliter. That is a normal value of B type BPN. Now next is creatinine kinase. It diagnoses for the acute MI elevated level of creatinine kinase diagnosed in a myocardial infarction. Here, your conduction of impulse in a heart muscles will be altered if the value is differ from the normal value creatinine kinase, and uh, it disturb the rhythmicity of your heart. Now, C reactive protein CRP. CRP is a maker for the inflammation, and the atherosclerosis has inflammatory component. The patient is elevated level of CRP have increased the risk of heart attack, stroke, sudden death, and vascular disease. CRP level less than 1 is lower risk. If CRP level is 1 to 3, that is intermediate risk. And if CRP level is increased more than 3, that is highest risk. And now, next is lipoprotein. For this chapter, you can refer your entire pathological report, whichever your report you are having in your home of any patient, you refer that 2 or 3 times. Then you can understand which type of test we are conducting in a body or conducting for the diagnosis of disease, and what are the normal values and what are the abnormal values, and what happened when the value differ from the normal range. This all kinds information you will get from that particular report. So my sincere advice to you all, you go through the report you are having, any report of any patient, your mother, father, or sister, brother, or any old report, you refer, and you just uh, try to understand the how it ranges between the normal or differ from the normal values. So this is a good practice for you. Now, next is lipoprotein phospholipase, that is the enzyme. The elevation of LP level indicate the greater risk of plaque formation and greater risk of cardiac event or cardiac disease. Now, next is measurement of total cholesterol. We have only 2 minutes, so we can finish this slide, and tomorrow we will take. A lipoprotein panel is a blood test that can help so whether you are at a risk for the coronary heart disease. This test look at the substance in your blood that carry cholesterol. The lipoproteins panel give the information about total cholesterol, that is LDL, low density lipid, that is bad cholesterol. This is main source of cholesterol build-up blockage in a artery. So your LDL value must be low, and HDL cholesterol, that is high density lipid, it is called good cholesterol. This type of cholesterol help to decrease blockage in the arteries. Triglycerides are the type of the fat in your blood, that is comes under the HDL category. Now, lipoproteins panel measure that the level of LDL and HDL cholesterol and the triglycerides in the blood. The abnormal cholesterol and triglyceride level may be sign of increase the risk of CHD, cholesterol. Now, most people will need to a fast from 9 to 12 hours before the lipoprotein panel test. So dear student, today I am finishing up to this. Tomorrow I will start for some more test which is commonly going to uh, perform in a pathological laboratory as per the disease condition or to diagnose the disease of patient, like kidney function test, liver function test, urine analysis, lungs function test. So we will see these tests in tomorrow class. Thank you all. If you have any problem, you can discuss with me separately, or you can put a question in a WhatsApp.